Hi, Fraser. How are you?
Hi, Amani. I'm good. How are you?
I'm good. I'm great. I'm so excited about this conversation. So we've worked together for a couple of months, and that was about 3 years ago, at least the first round, right?
2000, March
Ex
2000,
yeah.
2020,
And
sorry.
20, so in 2020, so it's about 3 years ago. And yeah, so I absolutely loved working with you. And I think it would be good to maybe like talk about your experience working with me, like why, you got in touch with me initially and how was the whole experience, working with me and your progress and everything. So honestly, it's going to be just a conversation between you and I.
Yep.
And yeah, so let's go for it.
Okay.
So, if you do remember 3 years ago, so what was the reason you contacted me?
So the reason I contacted you was I was suffering quite bad rosacea on my face.
Right.
It started off in this part of my face, but it had actually crept all the way up on my forehead and into my head,
Mm-hmm.
and this side of my face as well. So it was quite bad, and I'd been to the doctor, and the
Mm-hmm.
doctor had prescribed antibiotic gel, and it
Mm-hmm.
didn't work. And then I'd purchased some wonder cure from Germany, tried that for 3 months, didn't work. And basically, a mutual friend of ours recommended trying a more holistic approach
Mm-hmm.
with you, doing a program with
Mm-hmm.
you. So that was the initial start of the program
Yeah.
between the two of us.
Mm-hmm.
Yeah,
And so, thank you very much for sharing your experience. And like, was there any apprehension, to work with me and to approach, whatever you were struggling with? In your case, that was, rosacea, to approach it in a more holistic way. Because very often, as you mentioned, we talk about, so we usually go to the doctor and we get some antibiotics, some medication, basically. So, doing something slightly different, or yeah, very different, actually. Did you have any apprehension?
I think, I mean, the rosacea was just the kind of the final presence. I've always suffered from eczema and a bit of psoriasis. So I've always had skin issues.
Mm,
And invariably over the years, I've had them since I was a teenager.
right.
Um, they've come and gone, but most of it's been dealt with either by steroid creams,
Mhm,
by antibiotics, whatever, never really cleared it up.
mhm,
So I think I came to you as another channel to try
yeah.
because I was getting exasperated with
Mhm,
trying things
mhm,
in the, if you like, the Western medicine route and
mhm,
not achieving any results.
right.
Every winter my hands would be covered with eczema, my elbows with psoriasis behind my knees,
Mhm,
and it wouldn't really clear up. It would,
mhm,
unless I got
mhm,
steroid creams or
mhm,
stronger creams. And the rosacea was just another presence. And I think obviously that for me
mhm,
was a bigger deal because it was so obvious
mhm,
right up the side of my face and into my head. It looked
right.
very, very rash like.
Yeah.
Um, and nothing seemed to be working. So
Yeah.
I didn't really have any qualms about coming to work with you. I mean, you'd been recommended to me by a mutual friend, so it wasn't like we were strangers.
Yeah.
And I'd seen the work you'd done with them, and
Mhm,
they had progress and success. So it felt like this was a different channel from the one I've been trying for 30 years, which hadn't really
mhm.
worked in any shape or form.
Yeah. So yeah, it's good to know. So you felt like you could trust me, basically, right? Good.
Yeah.
It's always
I
a good
mean,
thing.
we were introduced to a mutual friend,
Right.
and mutual friend had
Yeah. Exactly.
recommended you,
Yeah.
so it wasn't like we were strangers to begin
For
with. So,
sure, for sure. Did you actually know, just out of curiosity, did you actually know that there was a link between your diet and your condition, skin condition? No,
not,
right.
not at all. I
Mm,
wasn't aware of anything to do with gut health
mm,
and my diet,
mhm,
how that would make a presence in my skin conditions.
right.
Um,
Yeah.
and that was really the start. I mean, I suppose I was borderline skeptical to begin with, but I was prepared to try anything, try a different route, because the traditional routes I tried hadn't worked. So our program started. We started initially with a 3-month program, and within those 3 months, most of the presence of the skin conditions improved dramatically.
Yeah, I remember. And do you know, like, I remember we talked about a couple of other conditions that you were dealing with, right? So there was the skin situation, but it was also a couple of other things. Could you maybe like tell us more about it, about them?
One of the other things I suffer from is high blood pressure. A man of a certain age and of a certain weight, and suffered high blood pressure since my mid-40s, and I'd been put on blood pressure medication by my doctor. And obviously I'm an asthmatic, a long-term asthmatic. I've been an asthmatic since I was 12, early teens. And I guess the progress of the program, it became clear that not necessarily they were interconnected or connected in any way, but they were interrelated. So as we started the program and we started dealing with the skin issues through our program of diet and supplements, we also started seeing things like my weight was coming down, and in turn that was having an effect on my blood pressure lowering, and also my asthma improving. And the results really towards the end of the program, I mean, we did the first initial program for three months. By the end of the 3rd month, I'd lost about 15 kilos.
I remember,
which was quite a lot of weight. And in doing so, my blood pressure had normalized, or my blood pressure on medication was always normalized by medication, but it was borderline getting to the lower end, which meant that we could start approaching the possibility of reducing the medication, which we have, and my blood pressure has remained well within the benchmark range that it should. And the other thing was my asthma, and again, it might be due to the supplements, it might be due to the weight loss, but that meant that my asthma was much more controlled, and in being controlled, that I could reduce the medication. So I used to be on 4 puffs of an inhaler called Foster, 100 micrograms 4 times a day. I'm down to 1 puff in the morning, full stop. And I don't have any asthma attacks. I don't have any struggle breathing. I'm not struggling. So the conditions were all dealt with differently, but they were sort of they weren't connected, but they were interrelated to general health around my diet and my weight, and the supplements.
Absolutely. Wow, that's incredible. And I've got 2 more questions for you. I think the first one is, how did you feel? Because I remember, I know it was 3 years ago, but like I remember within, honestly, like the first couple of weeks, like we noticed a massive difference. I was quite shocked, because usually I know it can go really fast, but for you were so disciplined. You were like, okay, that's it, I've made that decision. And like, how did you feel within the first few weeks?
I guess as someone who's struggled with weight for years, years, I was really surprised, because that wasn't the objective. The objective wasn't his weight. That was just not something we were really thinking of. So, and the diet program developed, or you developed for me, I wasn't sitting here starving at the end of the day going, well, I have something to eat. I was actually eating very healthily and eating a lot. So I was amazed that
Mm.
I think in the first 2 weeks I lost something like 7 kilos, and then it just was like 2 kilos.
Mm-hmm.
It really came off very quickly, and I was really surprised.
Yeah, yeah,
And I guess that was the benefit of
for sure.
the program, the
Mm-hmm.
diet plan, the
Mm-hmm.
supplements,
Mm-hmm.
and then a byproduct of that was blood pressure
Mm-hmm.
uh, improvement, asthma management
Sure,
improvement. So
exactly. That is amazing, honestly. And I think the last question that I have for you is, so we mentioned, it was 3 years ago. And I know recently we started working together again, because there was a little bit of a relapse, which happens to, all of us. But now you're back on track.
yeah,
And what is really impressive, if I'm not mistaken, is that you have actually like more or less maintained your results over the past 3 years, and you're actually even healthier now, right? So in terms of like your skin condition, because I think it's been pretty much stable for the past 3 years, right?
I've
Yeah,
not had
yeah,
I've not had an outbreak of. I mean, you can. I
yeah.
don't know if you can tell on the screen, but certainly I have no rosacea on my forehead at all. I have very, very little. I mean, minuscule presence of it, maybe here.
Mm,
But in terms of where it was all a nose around my eye and
yeah.
here. I have not had any of that. In the winter, I'm not getting eczema on my hands.
Mm,
I'm just using a natural shea butter hand cream.
yeah.
I've not used steroids or hydrocortisone
Oh,
since the winter of 2019.
that's amazing.
Um, and my asthma medication, as I said, we're down to 1 puff a day,
Mhm.
and we've taken the blood pressure medication down by 2.5 milligrams
That is
a day. So all is good, really.
amazing.
And all I've done is not necessarily stuck directly to the plan that we worked on originally in 2000. Obviously, you can't do that forever,
Yeah.
but I'm sticking to the main principles that we discovered, which was that I'm allergic to dairy.
Mm-hmm.
Dairy seems to be one of the biggest triggers for me, and gluten seems to be the other trigger. So I can't say I've not had dairy in the last 3 years, or I've not had gluten in the last 3 years,
Mm-hmm.
but I would say it's once a month, maybe once
Mm-hmm.
a quarter,
Yeah.
probably. Um, and in doing so, nothing is coming back. So
That's amazing. Well done, you. Wow. I'm really impressed and super proud of you because you're really on top of everything. And I can see you're looking really good. The skin is glowing. So I think my very last question is like, what would you tell someone who's struggling with any form of inflammation, whether it's rosacea, type diabetes, hypertension, IBS, and who's tried the more conventional approach? So what would you tell them? When it comes to like holistic health, because a lot of people are a little bit scared or apprehensive, which is totally understandable. So what would you tell them? Yeah.
I mean, I guess the only thing I can say is I was a bit of a cynic.
Mm-hmm.
I was a bit of a cynic before I started doing this.
Mm-hmm.
Um, and all I can say is I've been amazed
Mm-hmm.
with the results. Far more results than I expected. I thought we could possibly get on top of the rosacea a bit,
Mm-hmm.
but I didn't expect the eczema to go in my hands. I didn't
Mm-hmm.
expect the rosacea to be gone, basically. The
Yeah.
psoriasis, which only really was present on my legs,
Yeah.
my knees,
Mm-hmm.
um, has not come back at all.
Mm-hmm.
Um, and in terms of the ongoing management of like weight management, asthma
Mm-hmm.
management, blood pressure management, all of that's changed. So,
Mm-hmm.
and nothing in the past has made that much of a dramatic change. So
Yeah.
all I can say is that my cynicism is gone. I would
Mm-hmm.
definitely recommend people to try a more holistic approach, because otherwise, well, you've got nothing to lose, really, in my opinion.
Yeah, that is very true. That is very true. Wow. Amazing. Well, I don't know if you have anything else to add to that, but I'm like,
I don't think so. I think I've repeated myself a few times, so
oh no, thank you so much, Fraser. Honestly, it's been amazing to work with you, and I wish you all the very best. I mean, we're gonna stay in touch anyways. But yeah, thank you so much for sharing your experience today. And yeah,
thanks very much.
thank you. Okay, I'm gonna